Good afternoon, everyone. My name is Gareth. I'm a pharmacist in Velindre Cancer Centre, so I'm based in Cardiff. So Velindre is a specialist cancer centre, like Clatterbridge, like the Christie. So we just look after patients, adult patients with a cancer diagnosis. So that's what we do down here in Cardiff, if you weren't sure where we are. So my background is I'm a prescriber. I work with a consultant called Dr. Ricky Fraser, and we run a joint pharmacist and consultant clinic, and we review patients that are on treatment for kidney cancer. So that's my background. So I've got a specialist interest in kidney cancer. And the reason I sort of talk this afternoon, it was one of my colleagues, a specialist nurse in Velindre, again, working in the same area. She asked then if I could put a talk together, and she gave me some pointers as to what questions had come up from our local support group. So hopefully the sort of presentation is pitched at the right level, and it sort of informs and then sort of provokes some questions as well, and we can sort of have a bash at answering those as we go through. So sit tight, hopefully sort of informative, and you enjoy the talk this afternoon. So that's a bit about myself. This is what I sort of intend to talk about. I thought I'd just go back a little bit to basics, so hopefully not telling you anything you sort of are already really familiar with, but just to sort of be clear what the kidneys do, sort of how we find out how the kidneys are working, and then when they change, sort of how we sort of pick that up, and then if there's anything we need to do with medicines that might be related to changes in how the kidney is working and what it's up to. A little bit then, although I'm not going to concentrate too much on the treatments for kidney cancer, this is more about when the kidneys aren't working as well, if there's anything we need to bear in mind and why that's significant for sort of me as a pharmacist, and also then your consultant or any other prescribers, and for yourself if you were thinking about taking any medicines that you might purchase over the counter. So I'm going to try and cover all the sort of questions that have come from our local group. Hopefully that's sort of informative and helpful for you as well. So that's the sort of general things that we're going to talk about this afternoon. I'll put a little bit in about herbal remedies as well, just to sort of our take here on it and what might be a sensible approach if you were thinking about those type of medicines as well. So if we just sort of go back, I'm just going to sort of let you guys know, probably already know this already, that's sort of where the kidneys are found in the body. So they're an organ deep within sort of the abdomen. The shape of the kidneys, well, they look exactly like a kidney bean, but obviously a little bit bigger. And if you're thinking about how big your kidney is, if you sort of sat at home now, like, oh, well, how big are these kidneys? If you clench your fist, roughly that's the size of the kidney inside sort of each of us. So it's about the size of your clenched fist. That's roughly sort of how it is inside your abdomen then. So something to do at home, just while you sort of sat there. And that's where they're located. So the main job of the kidney and why it's important for us, so just a little bit of background, is they are filtering the blood. They're getting rid of waste, they're getting rid of toxins. So it's our cleaners inside our body that we don't have to think about. They just do this job automatically for us. And I put some diagrams up. They look a little bit complicated now, but I'm going to try and just point out a few things. So this is the shape of the kidney. If you look a little section, this is where the action happens. And it's this little ball of blood vessels that's magnified here. So if you think about it, blood is coming into this little section here. There's a bit of pressure that allows the blood to be filtered for all the waste products, the waste toxins, all that to be pushed out. And then the blood's going to come out the other end. So it's going to flow out, and in this little bit here, and it's going to be nice and clean. So all that waste, all those toxins, any medicines that you don't need to be building up, all that's going to be filtered out, and sort of blood comes out nice and clean, hopefully. The important thing to think about here is how this works. There needs to be enough pressure to filter the blood, but you don't want too much to cause damage to these very delicate little blood vessels. And that's really how we protect the kidney. If you think about increasing pressure too much over a long period of time, that can cause some damage and affect how quickly the blood is being filtered. And again, if we sort of think about how medicines, how we get rid of those toxins and too much medicine from the system, it's all going to come predominantly through the kidney. So it's really important that it's sort of functioning well, and that we have a really good idea of how kidney functions in an individual. So if we click on a little bit. So when we said this is what the kidneys do, this is where they're located. How do we sort of measure this then? So you can't measure exactly. We could sort of collect urine, sort of how it's been, urine is collected and peed out over a 24-hour period. We could do that. We could measure that for every patient. But in practice, that's very difficult. It's very sort of hard for us to do that. And handily and cleverly, we've got some calculations that can just use one little blood test, and we can plug that into a calculation, and that'll give us a very good idea of how the kidneys are filtering the blood and how quickly they're doing that for us. Some of the terms you might be familiar with and things that you might have mentioned in clinic or doctors may have sort of explained to you, this EGFR, it's an estimate of the glomerular filtration rate. The glomerular is that little ball of blood vessels that I was showing you in the slide previously. That's where all the action happens, where the blood is being filtered. So this is an estimate of how quickly the blood is being filtered. And it's always given in the number of mils of blood per minute. And if you're not familiar with measurements of volume, if you think about a teaspoon, that's 5 mils. So that gives you an idea then of how many mils when I talk about sort of what is classed as really good kidney function, how much blood is actually being filtered. So I hope that was okay, guys. So we'll just move on a bit now. So that's the little bit of physiology, just a bit of a background to it. I don't expect you to remember this, but this is the calculation that we use, and this is what we sort of, our laboratories will do this for us. So in your specialist centre, in your hospital and in your GP practice, they're using a one blood test, and then they're using this complicated sort of equation. It's called the CDK-EPI equation. That has been something that's in practice for a number of years, and it's used across the sort of country and world really as a really good and accurate estimate of how well an individual patient's renal function, kidney function is. And it's always given in mils per minute. So now, sometimes that's a bit too complicated on the ward. So one other one, and this is just for reference, so I don't expect you to remember any of these complicated calculations, but there is a nice quick one that we could do as a snapshot of if anything has changed recently and how well the kidneys are functioning. So we can use another calculation. And again, this is an estimate. So we not have to capture and collect urine of a sort of a 24-hour period. We can use one of two calculations to work out how well the kidneys are functioning. So that's how we sort of do that. Again, the group in Cardiff had questions as to what EGFR meant. So hence the sort of previous slides. And I hope that sort of gives some explanation as to what that term actually means. So it's a calculation, and it's based on a blood test that we can easily perform. And it gives us a really good estimate, although it's not the same as collecting the urine over a 24-hour period, but it's a very good estimate of how well the kidneys are filtering the blood. And when I said it's always given in mils per minute, these are the sort of results that might come through. So if you had over 90 mils per minute being filtered through a kidney, well, that's like the Linford Christie, the Usain Bolt of kidneys. It's functioning very, very well. It's filtering the blood really quickly. As we age, and this sort of naturally will happen, the kidneys slow down a little bit, and depending on how much they slow down and how much blood goes through, that then tells us if there's any impairment. So you can see if it drops down to about 60 mils a minute, that's sort of roughly about sort of a normal range. If it starts to drop below 60 mils a minute, so 60 mils of blood being filtered through the kidney every minute, if it's below that, then there's some impairment, and that might be important for us to maybe think about how medicines are going to be removed from the body to stop them building up and stop them sort of causing some problems. So that's what EGFR means, and that's how we get to that point. So the other thing I was sort of thinking about then, well, why is this significant? The kidneys are really helpful in removing medicines so that they don't build up, they don't cause toxicity or side effects. So that being said, we've got to sort of think about then how we sort of interpret these results. So the kidney will remove a lot of toxins and a lot of medicines. And if they're starting to slow down, medicines could start to build up. And it might make you more sensitive to the side effects of medicines if you think about it slowly building up and you're not getting rid of it through the kidney. So maybe more side effects would be more common. And for some medicines, actually, if the kidney isn't filtering the blood very quickly, the medicine itself may be not that effective. So before taking any medicine, before any medicine is prescribed, it's really important to see what the blood tests are showing, see what this EGFR value is, and that helps us then to make sure that the dose is the right one and it's the safe one for any patient that we are prescribing or advising on. Ways to sort of tackle this again is there are ways of adjusting doses. The dose might need to be a little bit smaller. And sometimes there's the option then of using alternative medicines. So rather than one that is really sort of likely to build up, we can maybe think about a different one that the body will get rid of in a different way. So hopefully sort of that is okay. Again, I'm going to talk us through this, so don't worry about all the terms. It's just to sort of have an idea of what terms might be used if you became unwell. So sometimes the kidney gets a bit unwell, and that can be caused by a number of things. We refer to that as an acute injury to the kidney. So it's not that the kidney has had been punched or been sort of physically harmed, but something is slowing down how well the blood is being filtered through that little sort of specialist group of blood cells. And when that happens, and when it happens quickly, we say there's something acute. So that just means that it's happened quickly and it's not normal. So at that point, we say there's been an acute injury to the kidney. And during those times, if the kidney has been, if the function is slowed down very quickly and very suddenly, you might sort of start to feel or be sick. There might be some loose stools or diarrhea, might be dehydrated as well. And you might notice you're peeing less, you're passing less urine, and that can sort of progress to being confused and being sort of drowsy as well. So lots of symptoms might be related to that sudden and quick loss of how much blood is being filtered. So there's lots of causes for that, and hopefully then with really quick treatment, instead of it sort of progressing, we can sort of correct that, treat the cause, and the kidneys can then function as they were previously. So the acuteness means that it's sudden and that there's a cause for it. If that cause is sort of identified and treated, the kidneys then should carry on as they normally did, filtering the blood as quickly as they were before that acute injury happened. During those times, if the kidney is slowing down, it might be important to either hold medicines, so something that had been taken for a long time, perhaps in those sort of just while the kidney needs a bit of a breather, to hold off on those medicines. Otherwise, they potentially could build up, just like I was mentioning before. And hopefully when things resolve, all medication can sort of go back to previous doses as well. So as well as the acute side of things, there is something else that might happen. So there might be just a slowing down of the kidney over time. So that's referred to as chronic kidney disease. It's a long-term condition. It doesn't happen quickly. It happens slowly. Sometimes it's a progressive thing that happens as we get older. So there may be sort of a very slow and sort of chronic slowing down of how the kidney is filtering the blood. So that's known as chronic kidney disease. And it's different to that acute thing that might happen very quickly. So those are just some terms. I'm going to just talk now, if it's all right, just to sort of tie all that in. So we just sort of thinking about why it's important that we check how the kidneys are functioning, how quickly they're filtering blood, how we check that happens, and why that's significant for medicines. So if we tying all that in, the kidneys are the big sort of cleaners of the blood. They sort of will sort of get rid of toxins. That's their main sort of job for us. And really important that we know exactly how those kidneys are working, how quickly the blood is going to be filtered before we prescribe any treatments. So we got all that background, and now we're sort of thinking about medicines used to treat kidney cancer. So I'm just going to sort of think about it from the point of view of the filtering of the blood, how the kidney is working. So we're just going to sort of have a quick sort of think about that and talk through that, if that's all right. So the first group of medicines are the TKIs. These are sunitinibs, pazopanibs, cabozantinib, the little sort of group of medicines that we would take as a tablet or a capsule. So in a nutshell, these are medicines that are going to block little enzymes, little pathways within the cell that are important for a cancer cell if the cancer cell is going to get a source of energy, a source of nutrition, and it's going to be able to grow and multiply and divide. So the aim of these treatments is to stop the cancer cell being able to do that, and we're going to stop those little pathways that are called enzymes. We're going to stop those from being able to do their job, and ultimately then hopefully stop that cancer sort of growing and multiplying. So that's what these guys are up to. I know you guys sort of know this, but these are sort of side effects that are related to that. And sort of what we do, and I was sort of thinking of our group, and mainly sort of if you're about to start on a new treatment and how we sort of make sure these treatments are safe and suiting you. So and it'll be sort of similar up and down the country, is that we would have regular clinic appointments, and we'll be checking the blood test. And again, the blood tests that we do are to make sure that the medicine remains sort of safe, appropriate for you. So we would look at things like that EGFR result. We'd look at other things that may be sort of related to a side effect of treatment as well, really specific blood tests that would tell us if we needed to make any adjustments for the treatment. And something that we do here in Cardiff that may be similar to sort of other areas as well is that when we start a new treatment, we have an appointment with one of our education team. So we'll have a little talk through about what we might come up against, what sort of side effects we might be dealing with. And then we sort of also provide something called supportive treatment. So these are things that might help with diarrheal symptoms, with nausea. Because we've had lots of patients say that we've had sore mouths and ulcerated mouths, we also give some mouth care as well. So these are things to be kept at home. Should those side effects crop up, we can then give advice then as to how these should be used and hopefully sort of settle those side effects down quickly. So the supportive treatments we sort of run through in a education session, and we can sort of talk that through with our patients then as to when and how to use those and when to sort of get in touch with us again if things aren't sort of settling down. Some other things we do then if we are running into sort of side effects or problems with these treatments are maybe having a breather off treatment, a treatment break, reducing the dose. If we sort of still having the same problem, we can sort of look at that as well. And it is sometimes, although sort of not always, I appreciate that the option of thinking about a different treatment. So one of the other nib treatments that we could sort of think about, and we've done that quite a few times for our patients, switching across to a slightly different enzyme blocker, and that can be very helpful as well. I wanted to quickly mention, because again, it sort of came up as a question from our group here in Cardiff, just about immunotherapies. They're a completely different type of treatment, so side effects are completely different. What we're doing is hopefully helping our immune system to recognize cancer cells, so ultimately then they can get in there and attack and hopefully get rid of them. So the side effects now is management for us is completely different. It can cause just inflammation. So again, different approach now, rather than sort of trying to settle it down with medicines. What we say is really important that we know about this nice and quickly, and the earlier the treatment that we can sort of identify those side effects related back to the treatment, the more effective the treatment, the management of those side effects will be. So we always advise our patients, differently to our TKIs, that we say you can manage some of these at home. With the immunotherapies, we like to know about it, and we like to know really quickly as well. So different management approach because there's different reasons for why the treatments may be causing some side effects and things not to sort of be feeling right. I want to sort of talk quickly about this one, if that's all right, because I've made the slide very wordy, apologies for that. So I'm just going to talk us through so it's nice and clear. Buying medicines over the counter, well, there are a lot of medicines you could purchase, and this is sort of thinking about how the kidney is functioning, whether there's sort of any impairment there, and also then the treatment that you might be taking. So what I'd sort of say is non-steroidal anti-inflammatories like ibuprofen or like anything else that might come under that category. So a big dose of maybe an aspirin to take for relieving a headache, that would be a no-no. The non-steroidal anti-inflammatories, they can really cause a bit of bother with how much pressure is in that little glomerular tuft. So if you think about that little diagram that I showed, and I said there's got to be some, like a little bit of pressure in there, otherwise the blood won't get filtered. Well, these anti-inflammatories cause some bother to the kidney, and they can affect how the kidney regulates that pressure. So the kidney can just look after itself, but these anti-inflammatories make it harder for the kidney to maintain the right amount of pressure in that little ball of capillary small blood vessels. And if that pressure gets altered, it could cause that acute kidney injury. So as a rule of thumb, unless you sort of doctor or healthcare professional said, yes, it's okay for you to take an anti-inflammatory medicine like ibuprofen, I would say, don't go ahead and do it. A safe painkiller as a first line, if you don't already take it, would be paracetamol, and anything on top of that, then always just double check either your pharmacist or your doctor, your GP or your consultant in the hospital. There's some other things to bear in mind as well. There's lots of other medicines. I can't go through them all. However, cough and cold remedies, they've got lots of different ingredients in them. So it's really hard to be specific about what may or may not be a problem. Some of them have decongestants in there, which increase blood pressure. Increased blood pressure is a side effect of some of the treatments that we give, and also increasing the blood pressure is never good for the kidney functioning. So just be very careful and always double check, I think, if you're thinking about purchasing something over the counter. The other one I sort of just quickly mentioned is just some antihistamines. Some are sort of safe, and even if the kidney is not filtering as quickly as it once was, maybe sort of a little while ago, things like chlorpheniramine or loratadine are fine. But things like cetirizine may be a little bit sort of more difficult to give specific advice for. So as a rule of thumb, I think loratadine would be the safer option, and if you needed to take an antihistamine, but if in doubt, always double check. There's lots more information, just summarized really nicely on the NHS website. So I've put that as a link to it. And they run through just sort of basics and an overview of that. It's never going to be specific. Those sort of specific questions, hopefully sort of from your team, either the specialist or kidney cancer team or from the GP as well. And the pharmacy and the pharmacist, the local pharmacist, will be able to double check if that's okay for you. So some herbal medicines. Well, I suppose every time I speak to patients about this, they assume pharmacists are always sort of very not up for any herbal medicines, or sort of not sort of going to engage in that. The reason sort of being is, as a pharmacist, what I would base my recommendation on are medicines that are licensed, that have gone through very stringent clinical trials. So it answers some of the uncertainties about taking a medicine, although we can never predict how individual patients will react and what, if any, side effects will happen. But we'll be able to get a very good idea, and we'll know how to monitor and make sure that's as safe as possible. With herbal remedies, they don't go through that same process. So it's very difficult to say, actually, well, I know this is the common side effect if you take that, or I know we need to monitor this if you're taking that. That becomes difficult, almost sort of impossible with herbal remedies. So the general advice is that actually a lot of these are going to cause some bother for us, particularly in treating kidney cancer, in that they can increase blood pressure, and that's definitely not what we want to do if we're thinking about those, what I was sort of mentioning earlier about the importance of keeping the blood pressure nice and steady. And then some have really sort of big interactions with other medicines as well. So very difficult to sort of say they're safe. It really does sort of depend on the individual herbal remedy, and it also then will depend on how much testing that particular product has gone through. And because all the products don't go through the same process as a licensed medicine, so the medicines that we would prescribe, it becomes more difficult then to give assurance as to whether that's sort of safe. So I would think my advice would be just to hold off on them really, and not to sort of use them. And if you are thinking about that, really sort of discuss with your specialist team. So, and that's sort of all I was sort of going to talk through this afternoon. And I guess now we got plenty of time for questions. So hopefully that was useful. I'm going to